Hey everyone, it's Dr. John Burroughs at Springs Aesthetics. We're coming from one of my operating room suites, and I wanted to briefly go over NeckTite and Morpheus. So NeckTite uses a handpiece that's hooked to a radio frequency device, which is right here, and it's basically the most advanced radio frequency device to tighten skin. And it's extremely safe because it measures from the outside and it measures temperature from the inside. So this long probe part is the part that goes under your skin. And so basically you move it across the tissues that you're tightening, and it measures and it'll cut off if you get a temperature surge so you don't get burn holes through the skin and concerning issues like that. Now, areas where there's a fair amount of fat, like here or in someone's jowls, you can turn up the energy higher and it can actually destroy some of that fat, again in a controlled fashion. So if you want a smoother jaw profile or a little bit more definition to here besides just the tightening of the skin, then it'll aid in that and help you out quite a bit. Now, the NeckTite results, you get improvement, within a few weeks, but it really starts to quickly improve from 2 to 6 months and even out to a year. We advise our patients, everybody's anatomy is different, but typically I estimate a 40%, sometimes you can get 45 to 50% improvement depending upon somebody's skin quality and their aging and what is needing to be done. So that's nice because that's all without surgery. So we have Goldie here, who does not need any neck elevation. She's got the nice cervicomental angle there. It's not drooping down, and she doesn't have a lot of fat, turkey gobble going on right there. If she did have those things, then we can do a little liposuction as we're moving into doing this with this probe, and you just basically come from underneath the chin and you suction out that fat. But Goldie doesn't need that. But pretend Goldie had some sagging kind of turkey gobble stuff going on. Well, with your NeckTite, after you have infiltrated the tissues with what we call Tumescent Anesthesia, which is a really dilute local anesthetic basically. We use it for liposuction and procedures like this. The skin will be swelled up so that you can pass your probe for the NeckTite through those tissues in a very smooth fashion. And usually we do it from 3 sites, one from right underneath the submental area and a couple either right in front of the ear or just behind it. And that'll let you get the whole neck area that you're trying to address. Now, along with that, you can also do Morpheus, which is radio frequency application from the outside with these needles that go out. And you can control the depth from a lot to just a little, depending on the situation. If you're also trying to destroy fat with this external approach, you can, but it's going to do more with the NeckTite, but they can work well together. I kind of think of it like a sandwich where you want to have the bread on the outside and then your good vegetables and meat on the inside. So you're going to get a nicer result by working from the outside as well as with your NeckTite from underneath the skin. And these are done at the same time. Now, one nice thing about NeckTite is that it's a one and done for several years. I've had patients go as far as 4 years. Most of the time I suggest 3 years, and that's fantastic. And to get 40% tightening, if not a bit more in some patients, without any surgery, no sutures, that is very appealing, and it's been extremely popular. We've been doing the NeckTite for 4 years here. I was the second in the state to acquire this technology, and it's just, we do them every week. It's just been very popular. On some of my other teaching videos, we've talked about that we do it on the face, and there's other areas of the body such as bat wings and things like that that you can also do for that. It's very comfortable. Most patients, once they're numbed up, they don't feel anything. They often just lightly sleep while we're working. Now, while they're getting numbed up, if it's a bit uncomfortable for some, I'm one of those that I look at a needle and it starts to hurt me. For For those that are more sensitive, we have the nitrous oxide, and you breathe in 8 to 10 times, hold it, and the mixture of the nitrogen oxide and the oxygen is really going to help relax you. And it keeps you relaxed, and it disassociates you from the injections and any discomfort for about a good 10 minutes. And really, once things are numbed up, it's not uncomfortable. And once the tissues have been infiltrated with that tumescent local anesthetic, usually it lasts for an hour or more. Now, you might ask, how does it feel afterwards? Well, you're wrapped with the garment, so you just feel a little pressure from that, but it really doesn't hurt. I've had the Morpheus done on my forehead and crow's feet area, and it didn't hurt at all once we're done. In fact, I just did the laughing gas. The treatment was done, and then I stayed around the office for about 10 or 15 minutes, and then I drove home. No big deal. And so this really is an in and out procedure that gives great results. Now, along with that, we often, and quite often, if a patient has a lot of sagging skin, where it's like hanging down like grandpa or grandma, they may need more draped up, and you can get a nice immediate result doing the MyEllevate suspension lift. And basically it's a canopy, or a hammock of support underneath the chin and jawline here that's anchored behind the ears, and it will lift right away, and it gives amazing results. So they're often done together because they give different elements to neck rejuvenation. The Ellevate will give you an immediate tightening. The NeckTite and Morpheus build upon that tightening, and they also improve the skin quality externally, and they also help with reducing some of the fat that might be there. And then if you have a lot of fat in that area, you can do the liposuction at the same time and then do your Ellevate suspension lift. So this has been very popular. It's great because you come in, you get it done, you go home. You really only have a couple of days where you shouldn't be getting the area wet. You wear a support garment at night for a couple of months just while you're sleeping, and it gives great results. And a lot of people are scared of surgery. They don't want surgery, but they want something that actually works, and this does. So it's been very popular. I hope this has been helpful and informative, and thanks for watching.